Can you read the nurse card?
Yes, sir. An 18-year-old female with undiagnosed anorexia nervosa has presented to your emergency department with an abnormal heart rhythm caused by her poor nutritional status. Cardiac treatment has stabilized her heart, but she is still currently receiving a potassium infusion via a drip to prevent further such problems. Other than when she wants you to explain treatment to her, she is defensive and angry to communicate with and in denial that she has any kind of eating disorder or mental health issues.
Yeah, first of all, when you read the card, the first important thing, as I told, a card will be like this given to you. Simultaneously, they provide a paper and pencil. By reading the card, whatever point that you have to speak with, you can make note in the paper. And once the card has been taken after 3 minutes, all the points that you have recorded, you have made note in the paper that you could use and you can look and speak. Okay, so the 3 minutes preparation plays a very, very important role. All the whatever your question, what is your task, everything you have to make note in the paper. So first your understanding is the setting, the place is emergency department. And here when you read, it is clearly given an 18-year-old. So who is your patient? What is the age of the patient? Hello?
Yes, ma'am.
What is the age of the patient?
18-year-old, ma'am.
Yeah,
18-year
patient is
female patient.
18-year-old female. And what is the
Yes.
problem of the patient?
Um, Undiagnosed anorexia nervosa.
Yeah, say undiagnosed. It is not a diagnosed, but she suffers from anorexia nervosa. Okay, that's the reason she has been admitted in the emergency department because she had all the symptoms of abnormal heart beat, and then she has got the nutritional status is not good. It's quite poor, and she suffers from some cardiac treatment in order to stabilize that. The potassium infusion has been given through the drips and via the IV, and but she is reluctant and she doesn't want to go for the treatment. The girl, 18-year-old, she is a defensive. Defensive means she doesn't want and she is perturbed. She gets angry. And she is non-cooperative. She is not answering. She is not communicating properly. And when you find out that she has got the eating disorder, and that is connected to the mental health issues too. She is defensive and she is quite argumentative and she is not agreeing whatever you say. So as a nurse, your task has been given. You have to reassuringly answer her anxious questions about the intravenous drip being given to stabilize her electrolytes because the drips has been given. She doesn't want the drips. She is arguing with you as a nurse why it is given. So you have to convince and you have to comfort. You have to explain to her why the IV has been given because of the potassium level is low. Because the potassium is low, it could really affect the brain function. So mental issues will be there. So that as a medical student, you have to explain it clearly why the intravenous drip has been given, why we are giving the potassium infusion. If it is not given, what will happen according to that? These are the general understanding you have to understand and speak. Then you have to tactful enough in order to make her how to understand what is the eating disorders that she has got and what type of food is she into. Is she eating or not? And what kind of a problem because of not eating properly she is facing. Indirectly, tactfully, you have to make her to realize. However, you try your level best. According to your card, you are speaking, you are trying to convince, you are making her to understand. But she is reluctant and she is, argumentative and non-cooperative. She says that doctors are crazy, you are all money-minded people, you mint money, and you people are only just wasting her time like that. But somehow at last you have to convince counsel and you have to make her to undergo the treatment. So this is the role play that you have to play according to this particular card. Step by step, first you have to start your greetings. Greetings means always you have to start as it is morning now. You could say that good morning and then self-introduction. You could give what is your name and what is your designation. And then as I got admitted in the hospital in the emergency department, generally how do you check with the patient? How do you do? How may I help you? And how could I address you, because the name of the patient is not given. So these questions in the beginning you have to speak. This is how you have to speak. Then I would answer. So based on what I answer, you have to speak.
Yes, ma'am.
Try it. You start your speech.
Yes. Hello, good morning. My name is Vishnu, and today I am attending this. I see that you are a little bit worried about something. So, how may I address you?
Good morning, nurse. But I'm not in a mood, to answer your questions. First of all, I'm very much worried about my condition, and why do I got admitted in this hospital, and why this intravenous has been given to me. It's quite disgusting and embarrassing, and I don't like it because I'm very particular about my personality and figure, and it might harm me. Why don't you remove this IV? And why it has been given to me? And you asked my name. My name is Rita.
Okay. So, Rita, your worries are understandable, but let me reassure you that this intravenous drip is for your improving the electrolyte which are imbalanced in your body, because according to your age and weight, you don't have proper nutrition in your uh, you don't have a proper nutrition. So for that, to cope up with that, we have started with the intravenous drip.
No, how do you say that, according to my, age, my weight is not there? See, I know that what I eat, how much I want to eat, I'm eating. So what do you call the problem that I have? What problem do I have? Why I'm in the emergency?
Uh, Certainly, so Rita, actually that problem is a medical condition where you starve and you don't feel to eat food. So that is a medical condition, but you cannot understand that. And for that only, we have started the drip, and it will improve your heart rate also, and even electrolyte balance.
Okay. See here, Vishnu, you have to say that you have to directly say, well, as you asked, what is your medical condition now? It is undiagnosed, but we guess it is called anorexia nervosa. Okay. And you have to say that anorexia nervosa is nothing but it is a kind of eating disorder that you feel obsessed about your weight, that you feel that if you eat more, you will put on weight. And that's the reason you are restricting yourself from eating. So it is a kind of disorder that we are very particular about the body image, and it is unwarranted fear that you have that you might gain weight. That's the reason you are starving and you are not eating properly. But it is a kind of disorder that is in the mind, that is in the it is a kind of mental disorder, we call it as. So you have to come out of it, you have to cooperate. As you starved, you didn't eat food properly and proper nutritional food. That's the reason you have got admitted in the emergency department. And we need to provide your brain this potassium. That is why the potassium infusion has been given via this intravenous. So if you say no for it, definitely you would collapse. So you have to agree for the treatment and you have to cooperate. That is my request that you have to say. Okay.
Yes.
So this much you have to speak. Right, and there are various and the types. So if you say it that way, then as a patient, I would say that what is this anorexia nervosa, and what is wrong if I am taking care of myself? What is wrong that if I feel that I have to maintain my figure, and in what way is it bothering you? So, because a little nutty, the patient will speak without realizing the situation. So here again, once again, you have to say that, as the food intake is insufficient, that is why you feel weak and tired, and you feel like vomiting, and you could not concentrate in any of your activities. And that's the reason we are requesting you to go for the treatment and improvise your health. And hereafter, you have to take proper food. That is the only way you could overcome this current situation that you have to say.
Okay, ma'am.
You have to clearly explain to the patient. So if the patient, what kind of further development could be there, and the patient might say, so if I'm not cooperative, what could happen to me? Then you have to say the exact cause. If it is that the patient is non-cooperative, the psychological and disorders will be there. And so we are arranging for the because according to your card, it is clearly given. You have to say to the patient that as you are not cooperating, we would arrange for the psychiatric treatment. Yeah, we could arrange for for that also. I would be saying that I don't want to see a psychiatric. Am I mad? And why you people are crazy like that? I would be shouting. It's there or not in your card with that last statement? Are you there?
Sorry, ma'am. Hello.
In your card, you have to advise her, that it is that a mental health doctor will come to see her. Mental health doctor means psychiatrist.
Psychiatric doctor.
Yeah.
So directly, ma'am, we have to we have to rephrase it.
Yes.
Mental
You have
doctor
to
or
use it.
psychiatric
Because you have to use it. It is very clearly given in your card, right? When it is given, you have to use it. Because the patient is not understanding that she is very particular about figure and maintaining, and she doesn't want to gain weight, and as it is become a stigma, and it is a kind of a paranoid she has become. So paranoid means automatically it is a kind of mental disorder for everything having fear. Okay, she has become a paranoid. So you have to use these terms. I could understand, but as of now, you are getting paranoid about weight gaining, and that has led to a kind of stigma in your mind, and you are suffering from a kind of mental disorder. So it is it is advisable from our side. We would arrange for a mental health doctor. You could say a mental health doctor, or otherwise it is called psychiatrist. Okay, so we would arrange for a psychiatrist soon. So if you take the counseling and discuss with the psychiatrist, you will understand your situation. So when you say that anybody who, if you say that you have to go for a psychologist or psychiatrist, they will get angry. So based on that, I would react, and I could be defensive, and I would say no. I would call and shout. And you have to convince. So that is the card. You have to understand the card. This particular card is quite tricky, that the patient is having some kind of problem. It is not only the eating problem that has aggravated and become a kind of mental disorder for her. And whoever says whatever, she is reluctant. She stands on a point and says that I don't want to gain weight, and what I eat is sufficient to me. And if I want, I can eat. And she doesn't want anyone to comment on her eating habit. Or as a nurse, you have to see, it is clearly given in the second task of yours, tactfully ask her about her eating habits and food intake. So you have to ask what type of food are you eating, what is your eating habit. But in my card it is given, once you ask this, I could be reluctant, and I have to question what is bothering you. Why do you ask about my eating habit? Like that, I have to react. So the patient is little paranoid, and she is reluctant. She doesn't want anyone to question her, especially about her eating habits and food intake. And but you have to make her understand that it is a kind of therapeutic session. So you have to know what is the problem so that the treatment could be advisable. As she is reluctant, she doesn't want to disclose, then in the last dialogue you have to use it. Well, as you are not understanding your situation, we could arrange for a psychiatric session. So a psychiatrist is the right person who could discuss and check your health condition and mental status. Based on that, a proper treatment and medication could be given to you. That's the only way you could tackle the situation as of now. Otherwise, you could collapse, it could aggravate. So that idea you have to see.
Ma'am, it won't be like being rude. It is like a
It is given in card. What is given in card, you have to speak. If you are speaking it on your own, it is rude. You have to speak what is there in the card. That is your role. You have to play the role.
yes. And
Okay. So keeping all these points in mind, step by step you have to speak. So can you start it from